Rheumatoid arthritis is one of the joint diseases which affect people from their very young age, as opposed to osteoarthritis, which is degenerative in nature and is an old age related problem. Rheumatoid arthritis is a problem that can affect people from a very young age. The incidence is 3 times more in women as compared to men. So there is a concept that probably the hormones also play a role in rheumatoid arthritis. But the primary problem in rheumatoid arthritis is a condition known as autoimmunity, where the body's immune system attacks the joints thinking that it's a foreign body. Since the problem is autoimmune in nature and the body's own immune system is the basic cause of the problem, in rheumatoid arthritis, the immune system attacks the joint and over a period of time disables the person by creating degeneration of the joint and disfigurement of the joint. This is to be treated very aggressively and kept under control so that the joints are not damaged. The major part of the treatment is critical before the joint is damaged, and once it is damaged, it is very difficult to reverse the damage that has happened to the joint. Therefore, it is very critical to start treating rheumatoid arthritis at a very early stage and ensuring that it comes under control at the earliest. Rheumatoid arthritis is characterized by swelling in the joints, by pain, sometimes there is warmth, there is a red color, so on and so forth, which are all the cardinal signs of inflammation. And that is why it is categorized as one of the most common inflammatory diseases of the joint. There are two, broadly you can classify rheumatoid arthritis into seropositive and seronegative rheumatoid arthritis. There are patients for whom a factor called as rheumatoid arthritis factor, RA factor, and another factor called as anti-CCP. If these two are positive, those patients are called seropositive rheumatoid arthritis patients, and those for whom these factors are not positive are known as seronegative rheumatoid arthritis patients. Both undergo sort of a similar problem, but people who have got a seropositive rheumatoid arthritis suffer from a more severe form of an attack, and it is more likely to cause damage to the joints. So the response rate is slightly different between the seronegative and the seropositive arthritis. This problem has got a tendency to keep recurring. There may be an episode of flaring up, and at that stage, after some treatment, the condition actually becomes a little bit silent, and that stage is called as a stage of remission. Very often it is mistaken to be cure. With some intervention, when the patient is becoming asymptomatic, patients generally assume that they have been cured of the problem. But it is wrong to consider that as cure, because there is a tendency for this disease to keep coming back. And every subsequent episode is generally more strong than the previous one. So it's very important, one, to reduce the inflammation and the damage that is happening to the joint in the acute phase of the problem, and also to ensure that rheumatoid arthritis is not coming back, because each episode is likely to be more powerful or more stronger than the previous one. There's a lot of advancement in modern medicine in the treatment of rheumatoid arthritis. In the earlier days, the primary mode of intervention was to use anti-inflammatory medicines, starting from aspirin. Then there was a whole bunch of NSAIDs, as they are called, non-steroidal anti-inflammatory drugs. These medicines are used to keep the inflammation under control, and they are very often very successful in giving good relief to the pain and other aspects of inflammation associated with the disease. Nevertheless, they don't constitute a cure for the problem because they don't address the autoimmune situation in any way. Then came the advent of the drugs that are called as disease-modifying anti-rheumatic drugs, starting from methotrexate, and you got chloroquine, hydrochloroquine. There are, even gold was used as an injection earlier. Now it's no more in use, but there are several other sulfasalazine and a whole lot of disease-modifying anti-rheumatic drugs that are in vogue today. These drugs work on modifying the way the immune system works. They sort of suppress the immune system and prevent the immune system from completely damaging the joint. One of the other most important drugs that is used in a very severe, powerful autoimmune reaction is the steroids. Steroids form a very important part of the treatment when it comes to suppressing a very powerful sort of an inflammatory episode. But as we all know, these powerful drugs which are modulating or which are sort of interfering with the immune system, though they are very useful in the acute phase, are not very great when you talk about long-term use because they have a lot of side effects associated with them. While they control the disease at one end, they are capable of producing several other diseases at the other. Especially steroids are notorious for producing other conditions which can be even worse than the fundamental disease. Though in the acute phase they are life-saving drugs, in the long term, very often it is preferable not to be having to continue the use of these powerful medication. It is in this juncture that Ayurveda comes up with its offering of wonderful holistic solutions to the treatment of rheumatoid arthritis. Ayurveda understands rheumatoid arthritis as a condition called as Vata Rekta or Vata Shonita or Amavata. The inflammatory stage is called the Amavata and the chronic stage is thereby. Ayurvedic treatment comprising of Ayurvedic herbs, very popular ones are Tinospora cordifolia or Amrita as they are called, Kogilaksham is used, Punarnava is used, Deshamola. There are several Ayurvedic herbs which are very effective in the treatment of inflammation associated with rheumatoid arthritis. They are also able to modulate the immune system and slow down the immune attack on the system over a period of time, and they are able to also bring the system to a stage of very good remission and keep it in the stage of remission over a period of time. But very often, since rheumatoid arthritis is a very powerful condition, just the use of medicines is not adequate. That is where the Ayurvedic treatment protocol comprising of Panchakarma becomes very important in the treatment of rheumatoid arthritis. When we talk about Panchakarma, very often Panchakarma is a misunderstood word. People perceive Panchakarma to be just oil massage. Oil massage is just one of the small preparatory procedures to prepare a patient to undergo proper Panchakarma. The most important Panchakarma procedure that is recommended for rheumatoid arthritis is called Vasti, which is where we administer herbal decoctions and medication through the rectum. This is able to produce a dramatic effect in improving the inflammatory markers, and it reduces the whole inflammation in the system. A series of enemas are administered over a period of time in protocols which are called as Yoga Vasti, Kala Vasti, Karma Vasti and so on. And such procedures are very effective in reducing the inflammatory tendencies in the body and bringing the patient to a state of remission. Ayurvedic treatment, especially combining Panchakarma, which is predominantly of Vasti in the case of rheumatoid arthritis, is thereby seen to be very effective in the treatment of rheumatoid arthritis, especially when it's a chronic condition, where one wants to avoid the negative effects of very powerful medicine. Ayurveda has a great alternative to offer by way of Ayurvedic herbs which can be used for continuous prevention and Panchakarma. Even after a course of Panchakarma treatment which will bring down the inflammation and bring it under control, thereafter it is advisable for a patient to undergo periodic Vasti. At least once in a month, a small course of Vasti would be very effective in preventing the recurrence of rheumatoid arthritis and such similar autoimmune diseases. It is this sort of an approach that AVN Arogya Ayurvedic Hospital brings to the treatment of rheumatoid arthritis. We at AVN Arogya have a full-fledged hospital in Madurai where we can even admit and take care of patients who are very severely affected by rheumatoid arthritis. We sort of admit the patients, give them a whole course of Panchakarma as well as the herbal medicines. In several cases, they are even on disease-modifying drugs and so on and would like to get rid of them because they are suffering from several side effects and so on and so forth. They are not able to tolerate the drugs. So in many cases, we have been able to parallelly administer the Ayurvedic treatment and slowly help the patient to withdraw the powerful medication, and then they are able to sustain themselves without the need for that. However, in very few cases, it might be necessary for the patients to also continue to take some of them. There is even a further advancement in modern medicine in terms of biologicals, as they are called. They are monoclonal antibodies and so on, targeted at specific mediators in the process of inflammation like TNF-alpha. So these biologicals also are very, very effective in preventing damage to the tissues from happening. And they need to be administered continuously forever, for many, many years. And this very effective in patients where nothing else works and the joint damage has to be prevented by any means. So in those patients, the use of biologicals is really life-saving, or sort of it is able to save the joint. But it is not without its own share of problems. The use of biologicals like TNF-alpha blockers predisposes the patients to other infections, and especially to tuberculosis in the context of our country, because tuberculosis is so rampant, and when your immune system is really suppressed, it's a very common condition that people can develop tuberculosis. So the Ayurvedic intervention in many cases is able to avoid the need to use these powerful interventions and provide a very effective sort of a solution to patients with rheumatoid arthritis. Though it is not right to call it as a complete cure, Ayurvedic treatment is able to bring in excellent remission in patients with rheumatoid arthritis and keep them in remission without the need to use powerful drugs. AVN Arogya Ayurvedic Hospital, 175 Villacheri Main Road, Madurai 625004, Tamil Nadu, India. Call +91 9025 700 400. URL www.avnarogya.in. Centers in Chennai, Bangalore, Mumbai, Cochin, Madurai and Malaysia.